Dr. Katherine Henderson is president of the Royal College of Emergency Medicine and a consultant in emergency medicine at St Thomas's Hospital, where the Prime Minister is presently being treated. Joining us now. Hello to you, Doctor. Thank you for joining us on the programme. What is the situation like at St Thomas's at the moment? Do they have all the equipment that they need?
So, good morning. So, yes, I am president of the College of Emergency Medicine. And so, obviously, I'm going to talk to you more about the general picture in emergency departments rather than a specific hospital where things are very organised. But across the country, we've got emergency medicine teams working incredibly hard, some still in getting prepared stage, but many now seeing large numbers of patients coming through. And we're very glad that we managed to make the case for emergency departments needing better levels of PPE, the personal protection equipment, so that the very front line is protected.
OK, not asking you about the Prime Minister, just asking about the situation in the hospital that you work in, which is what I ask all doctors who are on the programme. Is everything as it should be in your hospital?
Yes, it is indeed.
OK, talk to me about people that go, patients, who go into intensive care. Why do they need to go into intensive care? And generally, how long do they stay?
So that's not, again, I'm afraid that's not a question that somebody who does emergency medicine is going to be the right person to ask. So I deal with patients who come in through the front door, come in via ambulance. We see them. We make an assessment of how ill they are. And then we have to make decisions about whether this is somebody who is safe to go home or somebody who needs further treatment, either as an inpatient on the ward or intensive care. And that's done on a series of tests, their oxygen levels, their chest x-ray, some blood results, and how hard they are working to breathe. And we will then get the right people involved, and then we get them seen by, say, an intensive care team at that point, and we'll make the decision as to whether they get admitted to the ward or go up to intensive care.
A&E admissions have fallen by 43% in the month of March. Why do you think that is?
So that's our biggest concern and a big message that we're wanting to get out there. We're worried that there's a number of reasons. One is that people very appropriately are worried that they're going to burden the NHS by coming, which is a very understandable reason, and that's appropriate. There's also a reduction in, say, road traffic accidents or people climbing ladders to do things on their roofs and falling off. So we would expect there to be a reduction of that. But what we didn't expect and what we're worried about is that there's a reduction in patients presenting, say, with a heart attack or a stroke. And there's no reason to think that numbers of those patients should have gone down. So we're worried that people are staying at home, partly because they're fearing that if they go into hospital, they might catch coronavirus. And we want to reassure people that we will keep them safe. We'll have them in a different area. We will be very, very careful to make sure that they're safe. But we do want people to come in with serious illnesses and serious symptoms rather than delay.
Is it also because we don't have enough ambulances?
At the moment, we've got a great deal of pressure on the ambulance service, but we've got no evidence that people are not coming in because they can't get an ambulance. We've got evidence they're not coming in because they're not coming in. They're not getting in touch to do that. Ambulance services are definitely very busy with coronavirus calls, but we haven't had examples of patients who've not been able to, come to us eventually late because they haven't been able to get in the first time.
OK, so we have anecdotal evidence of people contacting us at Sky News saying they've had to wait more than an hour for an ambulance or whatever. And that is, of course, because our ambulance staff are working so incredibly hard. But you don't think that that is contribution towards these figures?
Waiting an hour still means you're coming. And, we had problems, the problems in crowding, of difficulties unloading ambulances that we had before this crisis started. Because emergency departments, have been pretty busy places. Quite a lot of that work has stopped, but we feel it shouldn't. We feel that those people should be getting in touch and getting into hospital if they need it.
How are your colleagues, frontline workers, coping at the moment?
It's hard. It's busy. Our lives have changed dramatically. The way we work has changed dramatically. Most of our work is coronavirus related, so we're dressed in gowns and masks and visors for long periods of the day. But there are positives to this as well. There's amazing teamwork going on. There's a lot of deployment of doctors to emergency departments and intensive care units. So there's a lot of shared working, a lot of shared experience. So there are some positives about it, but it's hard work for everybody.
Yeah. On a personal level, to end with, Doctor, how would you feel if the lockdown was lifted on Monday?
I think it's really unlikely that that's going to happen. I think it will all be based on science, but I think it's unlikely that that's going to happen. We're seeing the wave of infections moving across the country. We need people to help break the transmission, so they're staying at home. So I think it seems hopeful that it would stop on Monday, but I don't think it's very likely. Just passing the peak is passing the peak. It doesn't mean that we still aren't getting lots of infections and lots of people needing treating.
Okay, Doctor, keep well. Thank you very much indeed for joining us.
Thank you very much indeed.